everybody, I'm very glad to talk to you today for Alzheimer Europe Congress. My name is Vaillant Ciszewicz. I'm PhD in psychology and I work in Nice Hospital, in France, in geriatric department. Today, I want to explain you the aim of one of my research program, which called Psydoma. What does it mean? It is a clinical feasibility study at home for patients and carers. Psychologists, nurse coordinator, and occupational therapists provide some non-pharmacological approaches at home. The aim of the program is to reduce psychological and behavioral symptoms in Alzheimer's disease. We also provide a psycho-educational program for the family caregivers. First, let's see the context. As you know, neurocognitive diseases are frequent into the world. The cases number double every 20 years, and currently we don't have any treatment against Alzheimer's disease. We also know that more than 19% of patients present at least one behavioral and psychological symptoms during the disease. The major part of patients, as you can see, 73% of them live at home with a caregiver. And then carers are often exhausted. They feel stressed and alone. So what can we do? Psydoma can be a part of the answer with several objectives. We want to study the feasibility and reproducibility of the study. We want to know if our program is able to reduce the behavioral and psychological symptoms, improve the quality of life for patients and carers, and also if it's possible to reduce the psychotropic consumption. We also study the caregiver's frailty using the HiCOP Monitor application. Also, let's talk about the method. The total duration of the study is about 14 months. Patients and caregivers come at first time in hospital for a simple consultation, for example, for memory problems. If it's possible, a geriatric doctor can address them to Psydoma program. The project duration for one couple participants is 7 months. The project will include 20% of participants, such as husbands, spouses, brothers, sisters. At the end of the study, an external evaluation was made by phone from Paris with the Médéric Alzheimer Foundation. For the first part of the study, called the first campaign, we have an interesting satisfaction rate. As you can see, it's about 96% of satisfaction. Now you have to take a look to our customized interventions. For example, psychologists can propose music therapy or art therapy or cooking activity for reminiscence therapy, as you can see here on the pic. For the caregivers, psychoeducation program was made once a week, and as you can see, we have different models built with the cognitive and behavioral therapy model. We talk about emotion, communication, stress management, and Alzheimer's symptoms, of course. All the sessions with caregivers and patients are evaluated, for example, with the neuropsychiatric inventory. Now look at the first results. As you can see on the left, the graph presents the results for 15 patients. We can see a decrease in behavioral and psychological symptoms in the first and last Psydoma visits. So now, take a look on the right. This graph presents a decrease on Zarit score, which means that caregivers' burden perceptions decrease with Psydoma program. And this is very important to us. So, now the preliminary results. I will show you some verbatims coming from Psydoma patients and caregivers, such as listening, kindness, support, I am not alone, I manage my emotion better. This is very important for us to have this validation coming from the participants. As a conclusion, strengths and limitation can be highlighted. The study is very original in France because it is the hospital that comes home with psychologists, nurse, occupational therapists. The project also take care about caregiver respite needs and give them some advices. There is a connection between hospital and city with Psydoma coordination, and we can say that it works well. But it is sometimes difficult to motivate caregivers to participate in the education programs. Our sample of participants is small, but it's normal because Psydoma is a pilot study. It is also not always easy to find a non-pharmacological solution for agitated behavior in the later stages of the disease. We are waiting now for the results of the study to have the pleasure to present them to you. Thanks for your attention. Hope to see you soon.